Hey everybody, Dr. Misty Kosciuszko here from New Horizon Chiropractic and Wellness. How are you? So I had a few patients this week that had some common questions, and I figured I'd reach out with a video and try and answer those questions for you so you can implement some quick and easy things at home to give you some relief. So one of the biggest cases that I see in my office is a case called sciatica or sciatic neuralgia, and that is the irritation of low back pain with leg pain, pain that goes down the back of the leg, typically tends to be sharp, really hard to move. This is the kind of thing that people say, oh, I threw my back out and, I got pain going down my leg. Very debilitating. So sciatica is caused from a number of different things. The biggest thing is what it is an irritation to the sciatic nerve, which is one of the biggest nerves in your body. Okay. If you look at, let's come over here. We're going to bring you over to Mr. Spiny. So if you look here, the body is made up of, this is your spine, your vertebra. In between your vertebra is your spinal canal, and then you have the peripheral nerves that come out the sides here. So what can happen with sciatica is either you have one or all of these things going on. The sciatic nerve is irritated. All the lumbar nerves that come out to the side here come out and make the sciatic nerve that runs down the leg. So one or all of the nerves are irritated, and this can be caused from either spinal misalignment, so your vertebra is fixated or misaligned out of its normal joint ranges of motion and joint positioning. That can cause inflammation and joint restriction and a lot of pain. And it can also cause spasming in the muscles. Now, the other thing that can cause it is a disc bulge. So the discs are the shock absorbers of the spine. They're right in between the vertebra. Let me show you over here on my other spinal model. They're the shock absorbers of the spine. Kind of hard on the outside, but gelatinous in the middle. Think of a jelly donut, okay? So this is what a normal vertebra should look like. And this is the jelly disc, the jelly donut disc shape here. As you can see, it's kind of... there's a curvature on the top here. Okay, so there should be space where the spinal cord is. When you have a disc bulge or a disc herniation, what happens is that spinal canal area gets smaller, and so the jelly material either pushes outward or extends into that canal, causing the nerve surrounding it to be irritated. So that's another possibility of sciatica. And the other one is degenerative disc disease. So in arthritis, spurs, and remember we talked about the nerves coming out of the peripheral spine. What happens is the spine, either with wear and tear or an old injury, the spinal tissue starts to break down. Those jelly donuts start to dehydrate a little bit, and the bones come closer together, so which causes a bit of a degenerative process that can cause bones to deform and actually cause spurring in the area those nerves come out and cause them to be poked at and irritated a little bit. So all three of those can be causes of sciatica. So a great thing to do if you're getting a bout of sciatica, besides calling me and coming into the office and letting me help you, right at home, grab an ice pack. Sciatic nerve is inflamed. Get that ice on there for about 15 minutes. Take a break for about an hour and then repeat it as you need to. If you can get on the floor, lie flat on your back. That is, if you can get back up if you feel like the pain isn't too bad. The other thing that I would recommend is laying down on your back, either on the floor or a bed, bringing your knees to your chest. Okay, that'll open up that area where the nerves are coming out, regardless of whether it's a misalignment, a disc, or a degenerative tissue that's causing the nerve to be impinged. Take that pressure right off that nerve, get your knees up to your chest. If you can do both and put some ice on it, that would be even better. And the other thing that you can do, and this was one for patients who are a little bit less severe, is a back extension. So think of a cobra if you're familiar with yoga. You can do that while lying on your belly and just extend your arms and press up to try and reduce that disc a little bit if there's a disc issue there. Again, this is not for people who are severe. This could irritate it a little bit more, so you just have to be careful. But you know, doing that cobra position, either laying down on your belly, or if you can stand, and think about just doing a little back bend, you know, just a few inches back, putting your hands on your hips and doing a few repetitions of that. That will help to reduce any muscle spasm and try and get some of the inflammation out of that area. Again, this is Dr. Misty Kosciuszko. If you have had or are having a bout of sciatica, I feel for you. It is not easy. But if you have any other questions, please come and see me or drop me a line online. Thanks, guys. Have a great week.